Vizballoons. Preparation. Precaution. A thorough understanding of the technical principles, clinical applications, and risks associated with endoscopic procedures is necessary before using this product. 1. Open the package and remove the Vizballoons from the pouch. 2. Prior to use, carefully examine the Vizballoons to verify that the catheter and package have not been damaged during shipment. Do not use if tip is frayed, catheter is kinked, or balloon material is damaged. Important. Completely shut off the air supply, or CO2 supply, on the processor unit of the scope. Connect the jet water supply to the auxiliary jet water port of the scope if applicable. Attach a plastic cap, one of the marketed and available distal plastic attachments, to the tip of the scope. Only 1 to 2 mm of the plastic cap should protrude beyond the endoscopic rim. Ensure the large plastic introducer completely covers the Vizballoon balloon protector. Insert the introducer with a Vizballoon and its protector into the accessory channel of the endoscope. Continue advancing the Vizballoon and protector into the accessory channel of the endoscope, using short strokes until the sheath exits the biopsy tip of the endoscope. Carefully remove the Vizballoon's protector. Fill a 10 cc syringe with 5 cc of sterile normal saline and attach to the stopcock. Place stopcock in the open position. Point the syringe downward and draw a vacuum on the syringe before injecting saline into the balloon to evacuate residual air from within the catheter. Slowly inject saline over 20 to 30 seconds into Vizballoon to slightly more than 50% of the balloon's fill volume. Ensure the Vizballoon is kept below the level of the syringe and the distal tip of the balloon is pointing downward, so any air bubbles will collect at the top of the balloon and be evacuated from the balloon on aspiration. Withdraw all the air and saline from the Vizballoon while ensuring the balloon remains below the level of the syringe. Slowly inject more saline until the Vizballoon reaches the diameter of the scope being used, usually not more than 12 to 13 mm. Do not inject more than 5 cc of saline. Carefully examine the inflated balloon for leaks. If leaks are detected, or the Vizballoon begins to deflate when gentle finger pressure is applied, remove the balloon and insert a new balloon following steps 1 through 13. Gently pull back on the catheter until the neck of the Vizballoon is completely inside the operative channel of the endoscope and snug against the protruding rim of the plastic cap, endoscope, and lens. Apply lubrication to the anal canal and shaft of the endoscope. Slowly introduce the endoscope cap balloon assembly into the rectum while visualizing anal canal. Advance the endoscope and Vizballoon within the center of the bowel lumen. At points of sharp angulation, observe the segment of the most prominent blanching out of the submucosal vasculature. The diametrically opposite point is the direction of the open lumen. Deflect the endoscope tip toward the open lumen. When progressive blanching out is observed, withdraw the endoscope until the blanching out disappears. Blanching effect is a visual reflection of the pressure exerted by the endoscope onto the intestinal wall, and vice versa, quantitatively and qualitatively. Use short bursts of the endoscope water jet to clear the lens and occasionally create extra space between the intestinal wall and the Vizballoon at points of acute angulation. Use frequent short in and out movements to pleat the intestine onto the endoscope. When end of the insertion is achieved, cecum or ileum, balloon may be deflated and withdrawn. Turn on the air or CO2 supply to the endoscope and begin to insufflate the bowel as needed to to facilitate exam and perform therapeutic maneuvers upon withdrawal. Remove the plastic cap after completion of the procedure. After use, treat Vizballoon and plastic cap as potential biohazards. Handle and dispose of in accordance with accepted medical practice and applicable local, state, and federal laws and regulations.